Welcome back to the 17 News at Noon podcast, where we share your news on your schedule.
Working in the spirit of the Golden Empire, this is 17 News at Noon.
Good afternoon, and thanks for joining us for 17 News at Noon. I'm Nicole Gitske. We begin with breaking news. Dr. Sean Conley is expected to provide an update on President Trump's condition after testing positive for the novel virus on Thursday. Now, President Trump just tweeting minutes ago he is expected to leave the White House in about 3 hours. Now, we are continuing and waiting on Washington to get ready with their briefing, and we will take it over to them as soon as we are ready. In the meantime, though, let's go to the latest now on the First Lady. Melania Trump is providing an update on her health this afternoon. The 50-year-old says she is feeling well and continues to rest from home after she and the president tested positive for coronavirus. Shortly before 11 o'clock this morning, Mrs. Trump tweeted, "My family is grateful for all the prayers and support. I am feeling good and will continue to rest at home. Thank you to medical staff and caretakers everywhere, and my contented prayers for those who are ill and have a family member impacted by the virus." The First Lady has been quarantining in the White House residence after she and President Trump were diagnosed with this illness on Thursday evening and began experiencing symptoms. And the White House press secretary tested positive for COVID-19. Kayleigh McEnany sharing the news of her diagnosis on Twitter today, stating she has no symptoms and has tested negative every day since Thursday until this morning's positive test results. McEnany says she definitely had no knowledge of Hope Hicks' diagnosis before holding this briefing on Thursday, and no reporters, producers, or members of the press are listed as close contacts by the White House medical unit. McEnany says she will begin the quarantine process and work remotely. And now to the latest on the coronavirus here in Kern County. Public health officials have reported 31 new cases today and no new deaths. However, since Friday, we've learned of another 15 lives lost to this virus. Most of those deaths were from July and August, another indicator of how long it takes to confirm a coronavirus death. We've lost 386 people to the virus since the beginning of the pandemic here in Kern County. More than 32,000 people in Kern have caught COVID-19 so far. More than 10,000 are currently recovering from the virus at home. 65 others who are suffering more severe symptoms are being treated in hospitals. And we're waiting to learn more this week if Kern County will be able to move out of the state's purple tier, meaning the most COVID-19 related restrictions. County Administrative Officer Ryan Alsop says Kern has been meeting requirements to be in the red tier since Wednesday. Moving into the red tier would allow restaurants, gyms, places of worship, and schools to open up for indoor activity. Health officials say the best way to help the county reopen is to get tested. Now, there are places all around town where you can get a free test. You can schedule a test by calling 211 or go to kerncounty.com. You can also make an account on this website, doineedacovid19test.com, to find a test site and schedule an appointment. You can use that site to check your results from previous tests. And there's a free testing site today at Larry Ryder Education Center on K Street. And then tomorrow, there's a testing site at Plaza Towers on Wilson Road. You can go at any point during normal business hours. Just go to doineedacovid19test.com. Well, a man was killed after being run over by a vehicle in a McDonald's drive-thru. Now, it happened last night around 10:30 at the McDonald's at the intersection of Coffee and Hageman Roads. Police say when they arrived, they found the man pinned under a vehicle in the drive-thru. According to Bakersfield Police, the man who died had been laying in the drive-thru, and the driver who ran him over says he didn't see him. The driver stayed on scene and cooperated with the investigators. Drugs and alcohol are not believed to be a factor. The identity of the person who died has not yet been released. And in your 17 Crime Watch, new information on an officer-involved shooting out of Mojave. We now know the name of the man shot. The sheriff's office says 39-year-old Mikel Eric Lewis Sr. died Friday night. KCSO says the deputy approached Lewis Sr. during a traffic stop. They had a conversation before the deputy returned to his car. Then Lewis ran off a short distance to his car and reached inside. The suspect charged at the deputy, forcing him to open fire. Lewis Sr. was killed, and KCSO said they found a gun. The deputy was not hurt. Now, in your education news, the Kern High School District is set to hold a board meeting today to discuss whether kids should return to school. The board will vote on allowing small cohorts of students back into the classroom for in-person instruction. Last week, the Kernville Union School District tackled the same issue, ultimately announcing it will begin allowing students back starting today with TK, kindergarten, and first grade students. The board meeting will not be open to the public because of the pandemic. However, you can watch the meeting tonight at 5:30 via live stream on kernhigh.org. And while the coronavirus continues to put local sports on hold, some residents are calling for athletics to reopen across the Kern High School District. A demonstration to allow high school sports is taking place tonight at 6 on Sundale Avenue. Organizers say masks and social distancing are required. The demonstrators want the Kern High School District to lay out a plan for sports and activities to happen this year. Deadly wildfires in California have now scorched more than 4 million acres, making it the most land burned in a single year. California fire officials said the state hit the record-breaking milestone Sunday. The 4 million acres equates to more than 6,000 miles or land larger than the state of Connecticut. Now, most of the damage has occurred since mid-August when 5 of the 6 largest fires in the state's history erupted. Lightning strikes caused some of the fires, which have burned hundreds of homes and killed 31 people. Now, there are still about 2 months remaining in the fire season. Nearly 17,000 firefighters are still trying to contain about 24 fires in the state. And Kern County Fire Department currently has personnel attending to the glass fire burning in Napa and Sonoma counties. The fire broke out last week and has scorched over 65,000 acres and is currently 30% contained. The glass fire is one of 23 major fires burning across the state. Let's take it over to Alex Fisher with a look outdoors.
Yeah, hi Nicole. Here in Bakersfield, we're looking at 87 degrees, so pretty warm out there. If you're out in the sun, you're definitely going to feel the heat. Unfortunately, because of all that smoke and haze, we're seeing the air quality warning that is in effect until 10:30 Sunday. 10:30 Sunday. So we still have a little under a week left of this air quality warning, and that only will go into effect as long as these fires continue to burn. So we're not going to see this. We're not going to see this go away until all of those fires have been extinguished. Here's a look at the real-time air quality readings right now. You've got unhealthy categories for our valley locations, our mountain locations. In the Kern River Valley, you're looking at very unhealthy air. Unhealthy air is going to be the main story for the next several days because the air quality alert is in effect. AQI today is going to be unhealthy. Here's a look at what you can expect today on the valley floor. You're looking at 90s for the most part, 93 in Bakersfield, 92 in McFarland. Up in the mountains, you're looking at 84 in Tehachapi, Kern River Valley, you're looking at the 90s, and the desert locations, you're looking at the low to mid 90s as well. Let's spread this out over the next 7 days, and you can see right here that we do have some relief on the way. So we've got just a couple days of 90s, then we're going to really cool things down. By the weekend, it will be below average. So right now, we're looking at well above average temperatures. By the end of the weekend, we will be below average. So fall is on the way. Here's a look at the mountain forecast. You can see 84 today. We're going to keep it into the 80s for just a couple days. Then we have the 60s by the weekend. And in the Kern River Valley, you're looking at the 90s today and tomorrow. And then we will, of course, cool down into the lower 70s by the end of the weekend.
Now, as we mentioned, that we are following 2 big announcements. One of those is regarding the president's health. Now, President Trump tweeted just about 20 minutes ago that he's expected to leave the White House in about 30 minutes. Let's take it over to Washington, D.C. right now and hear what they have to say.
Good afternoon, everyone. Thank you for being here. Over the past 24 hours, the president has continued to improve. He's met or exceeded all standard hospital discharge criteria. He'll receive another dose of remdesivir here today, and then we plan to get him home. It's been more than 72 hours since his last fever. Oxygen levels, including ambulatory saturations and his work of breathing, are all normal. Though he may not entirely be out of the woods yet, the team and I agree that all our evaluations, and most importantly, his clinical status, support the president's safe return home, where he'll be surrounded by world-class medical care 24/7. I'd like to bring Dr. Dooley up to review some more specifics.
Good afternoon. Just a brief update this morning. As Dr. Connolly mentioned, the president continues to do very well. His vital signs this morning were notable for a temperature of 98.1. His blood pressure was 134/78. A respiratory rate of 17 respirations per minute. His heart rate was 68 beats per minute. And his last oxyhemoglobin saturation was 97% on room air. He currently does not endorse any respiratory complaints. And aside from our evaluation with the multidisciplinary team this morning, has maintained a full schedule, ambulating and working on the White House Medical Unit. I'll now turn it over to Dr. Garibaldi to again discuss therapeutics. Thanks.
Hi, good afternoon. And again, I just wanted to echo the sentiment of what an honor it is to be part of this wonderful team here at Walter Reed. Yesterday evening, the president received his third dose of remdesivir. He tolerated that infusion without difficulty, and his kidney and liver function continued to be normal. Our plan is to give the fourth dose of remdesivir this evening before he goes back to the White House, and we've made arrangements to deliver the fifth and final dose of his treatment course at the White House tomorrow evening. He continues on dexamethasone, and again, the plan for today is to continue to be up and out of bed, eat and drink, and work as he is able. And I'd like to turn it over to Dr. Jason Blaylock, who's an infectious disease specialist and the chief of medicine here at Walter Reed, to give some updates on infection control. Thank you.
Good afternoon, everyone. First of all, I just want to say what an honor it's been to be part of this medical team behind me and to care for the president. Since the president's arrival at Walter Reed, he's received medical management that remains in line with national clinical societal guidelines for treatment of COVID-19 infection. In addition, both myself and Dr. Wes Campbell have worked very closely with various laboratories in the area, state-of-the-art facilities include USAMRIID and RARE, on obtaining advanced diagnostic testing to really inform the White House medical team of both the status of the president as well as his ability to transmit virus to others. Also, we have worked very closely with the Walter Reed team to ensure that we are looking very closely at infection control prevention strategies and the right posture so that the president can safely return to his residence. And with that, I'm going to turn it over to Dr. Conley, who will answer any final questions.
Thanks, Jason. I mentioned it Saturday, but I'd like to reiterate myself just how grateful the president and I are to the men and women of Walter Reed, our colleagues at Johns Hopkins, as well as the many federal, private institutions that we've received support from. And so long as everything continues on the track that we're experiencing right now, this time, as the president already tweeted out, is to get him home later today. With that, I'll take a couple questions.
Discharged back to the White House when he was given steroids. You've said that he's still on those steroids. Those are medicines, as you know, that are usually given to COVID patients who are on ventilators or with low oxygen.
You just heard the latest from some doctors talking about the president's health condition right now after testing positive for COVID-19. Now you can continue watching this whole live stream on our Facebook page and on our website, KGET.com.
Working in the spirit of the Golden Empire, this is 17 News at Noon.
The 17 News at Noon podcast is a production of KGET and Nexstar Media Group. For more on all of the headlines in today's show, head to KGET.com.